So today I'm taking about physical examination of a nursing. Okay. So first definition, it's a systematic collection of the objective information to directly observe. So citizen to the examination. So this is direct objective and indirect. Direct means what you observe and indirect means what are the patient is telling. Okay. So purpose to understand the physical or mental well-being of the clients, to detect the disease of early stage, to determine the cause and extent of disease, to understand the any changes in the condition of disease, to determine the nature of treatment and nursing care needed to the client. So here save to the client and family to yearly signs and contribute the medical search to find the person medically and particular task. So what are the technique here using means inspection, palpation, percussion, auscultation, manipulations. So inspection means what is the visible examination of the client. It is a process of performing deliberative purposeful observation of the systemic manner. It's involved to observation of the color, shape, size, symmetry, position, and movements. It also uses senses of smell to detect the odor and senses of hearing to detect sounds. So generally we can see the appearance of health or illness, signs of distress, and facial expression, mood, and body size, grooming, and personal hygiene. So palpation means use the hands and fingers to gather information to touch. So assessment technique, it will be sense of touch. It's feeling to the body part hands to note the size and position of the organ. The hands and finger sensitive tools can use temperature, textures, moisture, vibration, size, position, mass, and fluid. So here back surface of the hand and fingers used to the temperature. So palmar means front means we can use the pad used to assess the texture, shape, fluid, size, consistency, and palpations and vibrations of the palpated best palm and hand. Okay, so this is the palpations. Then percussions. This examination of the tapping the finger on the body and determine the condition of the internal organs and sounds to the producer. So here, so sticking the object to against the producer sound. So the ways is we can see. So whenever you are getting any stomach upset, we can tap, we can percussion, we can see inside sound variations. So determine the structure of hair filled or fluid filled, because some parasympathesis cases only it will be fluid fill will be there. So here hyperinflated of the lung tissue means hyper resonant sound will be here. Then normal lung tissue means resonant and liver means dull and bone for flat. So this is the percussions. So auscultation for means it's a listening of the sound within the body. So usually done with the stethoscope. So example heart heartbeat. Okay, so we can just breathe and then bubble sounds. We can keep the step into the abdomen. Then we can assess. So here pitching sound, loudness, quality, and duration. Pitching sound means ranging of the high to low. Loudness sound means soft to loud. Then gargling, it's a cramp like duration means short, medium, and long. So this is the auscultation. So manipulation means it's moving of the part of the body. It's not flexibilities and limitations of the movement is discovered to the movement is testing of protein. This response is external stimulus test they can use. So an hammer and safety pin and a cotton hot or cold. So neurological disorder we can use manipulations. So here seeing tunicate cottons and forceps they're using. It's a knee hammer. Okay, general examination of the head to toe examination. So first preparation of the environment and maintenance of privacy and lightening. So adequate lightening should be patient comfortable bed examination table. Okay. Then preparation of the equipment, preparation of the client. So physical or mental preparations. So what are the article we need? So spirometer for checking the BP, stethoscope and stethoscope. Then tray, temperature tape, depressor, and pharyngeal protector, then laryngoscopies, then tap measures, flashlight, veining machine, ophthalmoscopy, and otoscopy. Okay, then NIA work, tumor work. So here it will be there for So nasal factor designed by the naturalist and percussion over test the reflexes and vaginal to view the vaginal genital hormones and photocopies to the rectum and gloves and sterile specimen bottles if you want to collect. So this is all we need. Okay. So general examination means so patient have nourishment, well nourished or undernourished. Then body build, then health and activities. So health means unhealthy or mean body build, thin or obese, mental conscious, unconscious, deliriums, under talking, and even currently handshakes, worry, depressed, and etc. So this is not normal. Then postures. So body craves, lordosis, kyphosis, scoliosis, movement. So height and weight, skin condition is pallor, jaundice, sinus, and flushing. Texture means dryness and blackening, wrinkles to excessive moisture. Temperature is warm or cold, and lesion is populous vesicle sound. So here kyphosis normal, lordosis will be there explained. Okay. So then macros, papulos, vesicles. So this is another we can see that chin box variations for skin. Then head and face. So shape of the head and frontal. If your new beeping is the frontal we can check. Then occipital we can check. So skull circumference, scalp cleanliness and condition of the hair, dandruff, reticular infections. So face means pale, flushed, puffness, and fatigue, pain, fear, anxiety, enlargement of the pituitary glands. Okay. So here they given swollen of because it's some this cold season we can get this for swollen up pituitary glands. Then eyes. So eyebrows means normal or opposite. Eyelashes means infection or style. Then highlights means edema, lesion. Then eversion, then atropian inversions. So hypods means so this highlights are normally we can put some eyeliner using it will be happen. Okay. So hyper means uncan and produced. Congestive means pale red purulent. Then sclera. Then cornea hierasis means irregularities and oppressions. Then pupils means dilated constricted reaction to blood lines, oblique and transparent. So this is the variations of the eyes. Then fundus means construction and hemorrhagic spots. So high muscles means skilled the vision or normal myopia. So short then hyperphobia. It will be there. So ears means here external ear means discharge upshooting into ear passage. So normally you can see. Then tympanic membrane we can see. Then hearing quality abilities. Then this is the normal hearing. So nose means external crushes discharges. Nostril is information of the mucous membrane and septal divisions. So mouth means lips, odor, teeth, and mucous membrane, tongue, throat, and pharynx. So lips means swelling, dryness, and then stomatitis, some infection of the stomach, it will make stomatitis. So mouth also will be there. Then odor of the foul smelling. Teeth discoloration of the dental caries. Mucous membrane means ulceration and bleeding and swelling and thing. So dry and lesion, throat and pharynx, enlarged tonsil and dryness. Then neck means lymph nodes, enlargement, palpable, thyroid gland and enlarged range of motion, flexion and extension rotation. Chest means thorax, symmetry or asymmetric. Then posture, breath sound, wheezing or crepitations and pleural drop. Then heart means size and location, cardiac movement, breast means enlargement of the lymph nodes. So this is for neck lymph and extension maximum inhalation. So abdomen means observation, skin rashes, scare, hernia, ascites means full. It's collection of the fluid to the abdomen, distension, pregnancy. Auscultation means bowel sound. So fetal heart rate to the baby. Then palpation is liver margin, palpable spleen, and tenderness to the abdomen. Percussion and presence of the gas and fluid and mosses. So extremities damage, joints and tremors, clubbing, fingers, varicose vein. We can see for the lower extremities. This is a very common. This is the clubbing nail. So most of cardiac cases, it will be clubbing of nail will be there. Okay. So back means pinia bifida. So it will be one information of the mm. So bifida means it's a small inflammation of the neck back side. So many movies it will be like this. They're showing for the spinal fibula, then lingual implants to enlarge palpable patterns of the urimeters, rectum, then distance of the testis, vaginal discharge, presence of the fistula, hemorrhoids, then prostate gland. So this is in the spino bifurcated. So this will be accurate to the back side.